So our first speaker this morning, and I shouldn't say speaker, excuse me, our first discussant this morning is Dr. Tonse Raju. He's the Chief of Pregnancy and Perinatology Branch at the Eunice Kennedy Shriver National Institute of Child Health and Human Development at the National Institute of Health in Bethesda, Maryland. And if that isn't a title, I don't know what is. But he works very hard in this area. Prior to joining the NICHD in 2002, he served a long tenure as a professor of pediatrics and OBGYN and co-director of the Neonatal Intensive Care Unit at the University of Chicago. Now, any of you know anything about neonatology, you know he had a baptism of fire. So he knows about the babies, and he knows particularly about the group of babies that we're trying so hard to provide milk for, and those are the babies in the neonatal intensive care unit who will benefit most in this fragile time of their life to receive human milk. So he's been there, he's done that. He's also published 62 chapters. He's written 9 books, 5 of which are fiction. So maybe you can corner him and find out what he writes about. I don't know. His latest book is The Importance of Having a Brain. And I would applaud that. Tales of the History of Medicine. He translated proverbs from Canada and a South Indian language. Don't stand in front of a palace or behind a horse. So you can see he has a broad background and some interesting things to say. Dr. Raju.
Good morning, and thank you so much for that wonderful introduction. Now I have to live up to it. That's a challenge. So, as was told, that I represent, or I'm coming from NICHD and NIH, and Eunice Kennedy Shriver name was attached to our institute about 6 years ago. As some of you know, that without Eunice Kennedy Shriver, our institute would not have started. And in fact, within 1 year after her brother became president of the United States, she was able to move a legislative action to get started a child health institute. At that time, there were people saying, even scientists were saying, that children are like, like adults. Even a grandmother can take care of a baby. You don't need scientific research to take care of children. That was not long ago. It was in the 60s. So the institute started, and it has had its own wonderful effect. So as I stand here, I was thinking of what should I bring it to this discussion, and not a talk, this discussion, as Dr. Lawrence rightly said. I thought, given the time limit, so I wanted to highlight a few things. That I want to talk about the few recent research studies funded by NICHD, and one little editorial I wrote about ACA, Affordable Care Act, and a lot of times people don't know what is contained in that. It's a fairly large document, I am told. And we were having 2 workshops on combining the breastfeeding message and safe sleeping message. So I will begin my presentation based on these 3 elements, and then in a larger structure as to how NIH functions. So unless I bring that up, what I'm going to say may not really make sense. So if I can summarize the mission of NIH by just 3 bullets, and this is what we can say. The National Institute of Health is there to fund research, to support, to develop discoveries and inventions that will lead to generalizable knowledge. That means anyone can take that knowledge and apply it to take it further. So that is the most important component of NIH research. And just a wonderful example of that is how back in the 60s and 70s, Dr. Robert Furchgold got a grant, and he was trying to examine how does blood vessels dilate or constrict when the neurochemical substances come in. One day, one of his technicians messed up, and he prepared the aortic, a strip of the aorta, did not clean up the endothelium properly. And that certainly led to a relaxation of the endothelial muscles. And then he said, well, there must be something in the endothelium. So endothelium relaxing factor, which turned out to be nitric oxide, which turned out to be fundamental in doing a lot of research on nitric oxide, including Viagra. So initially, Viagra was tried on to help myocardial infarction, and unexpected side effect led to another branch of discovery and invention. So all began with research support to Furchtgott and similar investigators. So where these will take beyond that particular nucleus is almost impossible to gauge. The other aspect of that is implementation of research also is supported. How to improve, let's say, breastfeeding, according to this topic. We do support that, but even then, it's a generalizable knowledge to be generated from that. That means if you have one method versus another method, which method is more effective, etc. That's a research question. And finally, there is an education component. We want to not only educate the public about the research findings, but we also want to educate or train the future researchers. Especially clinician researchers is a brand that is going away very quickly. Because of the pressures of economy, they go into practice, they don't really get into academia. So that's another major issue that we tackle. Types of research on breastfeeding that funded by NIH include a variety of portfolio, very, very large portfolio, in fact, because it will begin from mammary gland biology and breast tissue development. It will continue on human milk. I'm just only quoting a few. Human milk, milk components, and human milk feeding. Now it's a big area of the milk bank and the stored milk bank of human milk. Barriers to breastfeeding and how to overcome these barriers. HIV and breastfeeding is a major area of research that NIAID, National Institute of Allergy and Infectious Disease, supports that. And cancer, the mammary biology and reproductive cancer. The National Cancer Institute is very much interested in research related to how breastfeeding modulates later women's cancer issues. So they have a very interesting set of portfolio. Nutrition and obesity, breastfeeding research, etc., and then miscellaneous. And obviously, in this 15 minutes and probably a little extra because of the first speaker is not here, I cannot cover all that, but I will try. A lot of people do not always keep in mind that NIH is a plural, National Institutes of Health. So we have 27 different institutes. It's almost like 27 independent colleges all put together under a big university, each one having its own mission. And starting from National Institute of National Institute of Aging to pediatrics. So these are all 20. You are not expected to remember all these acronyms, but these are the institutes. And the highlighted ones in yellow, there's NICHD is right there. NICHD should have been in the middle, but that's okay. These four of them at least are the major ones that do support research related to breastfeeding. So as an example here, I thought I will talk about 3 or 4 research that recently we have funded and what they have found. One of them I chose to talk about is titled as Maternal Clinician and Hospital Factors in Breast Milk for Premature Infants. This is awarded to Dr. Henry Lee, and he's at Stanford. Group intervention to increase breastfeeding duration amongst Puerto Rican mothers. We talked about how minority populations have issues, but in Puerto Rico, it's another issue. It's a huge problem of obesity and overweight, and this interaction of that is a very critical one. Boosting breastfeeding in low-income, multi-ethnic women, a primary care-based study from Dr. Barnack, and many of you may know her. I was expecting she would be here today, and the same as Dr. Dozier. She has had a long history of support from NICHD, and her title of her grant is Community Partnership for Breastfeeding Promotion and Support. And finally, promoting lactation education, access, and support effort for preterm infants, Sarah Taylor. So talking about the first grant, and if you see on the top is it a pointer? Is the red one is a pointer, right? Do you know? Is the red one is a pointer? Okay, that's all. That's okay. The first one, you see on the title, Henry Lee, right next to is K23.